Mr. Wilden, your next PQ.
Question 3, sir.
Sir, may I take questions 3 and 4 together?
Please do.
Sir, my response will also cover matters raised in the question by Dr. Wan Rizal, question number 4383, scheduled for a subsequent sitting. I'd invite Dr. Wan Rizal to seek clarifications today if need be, and if the question has been addressed, it may not be necessary for him to proceed with the question for the future sitting. Sir, the attrition rate of doctors in the public healthcare sector has remained stable in the last 3 years, ranging from 3% to 5%. Nevertheless, we continue to make efforts to improve the well-being of our doctors and retain them in public service, including the formation of the National Wellness Committee for Junior Doctors, the NWCJD, which has been studying initiatives to promote and improve the well-being of junior doctors in the public healthcare system. The committee is conducting a series of in-depth small group discussions with junior and senior doctors. Through these, we have sought to validate the approach to key concerns, such as the need to improve career pathways, address work hours, and improve work conditions. The committee is concluding its engagements with stakeholders and finalizing its recommendations. Early initiatives already in place include the appointment of chief wellness officers in our public healthcare clusters. These officers have a responsibility to enhance the well-being of all healthcare staff. We have also begun to expand and refine career pathways, such as the introduction of the hospital clinician scheme to provide doctors with more diverse career options. Sir, the worst of the pandemic is over and patient numbers have reduced. However, all our healthcare workers remain busy serving the healthcare needs of Singaporeans. The committee continues to review the working hours, working conditions, and well-being of junior doctors. It will take some time to study these matters and make appropriate further recommendations. Thank you, sir.
Mr. Yip Hon Wing.
Thank you, Mr. Speaker. I thank the SMS for its reply. Just one short SQ. Will MOH consider initiatives such as reducing paperwork and streamlining some of the admin processes to make a more conducive work environment for our junior doctors? Thank you.
Sir, the committee is indeed reviewing these matters, as well as the issues of night calls and duty hours. We are doing electronic logging and surveys to monitor the workload of junior doctors. However, the issue goes beyond just a simple redistribution of workload or the simplistic hiring of more manpower. Both may be necessary, but the changes will impact the overall optimization of our system in our current multidisciplinary model. It's a complex subject, and this part of the review will take some time to study and work out, and recommendations will be made. Thank you, sir.
Ms. Lim.
Thank you, Speaker. 2 supplementary questions for Senior Minister of State. Earlier he mentioned that junior doctors were being consulted as part of this review, but could I ask him whether there are any junior doctors on the committee itself, the National Wellness Committee? And the second question is, some doctors who had spoken publicly earlier had mentioned 2 key areas to be reviewed, which are mandating rest days and also to move away from 30-hour calls. So I'd like his confirmation that these areas are being looked at with some priority. Thank you.
So I thank the member for the questions. The answer to both questions is yes.
Mr. Pereira.
One quick supplementary question. Is the government looking at the cap of 80 hours per week? I believe that is still in place. Previously in the House I have mentioned that there is evidence from other jurisdictions that you can get the same training outcomes with a cap of 70 hours per week. So will that be reviewed by this committee?
So the committee is indeed looking at the issue of working hours for the junior doctors.